Hello, my name is Anne. I'm here today to introduce this DVD for your use. It is aimed at patients and carers on how to deal with problems during your chemotherapy. It is called The Do's and Don'ts of Chemotherapy, and I hope by the end of this you'll be able to know what to do when things go wrong. The DVD consists of an introduction which is important to watch. There are 5 separate scenes for which you can choose from. There are also patient stories which highlight the importance of knowing what to do and who and when to ring.
Everyone experiences chemotherapy treatment differently, and people have varying degrees of side effects. Your chemotherapy nurses will warn you of a number of side effects, but it doesn't mean to say that you'll get them all. If you do, let us know. Some of the common side effects we see are nausea, tiredness, sore mouth, hair loss, bowel problems, and increased risk of infection. Side effects are temporary, but can be bothersome and may even require a short admission into hospital. We're interested in you and want to do as much as possible to minimize the side effects and help you to maintain as normal a life as possible. An important side effect is the increased risk of infection. The most common time frame for this is 7 to 14 days after chemotherapy, when your white cells, neutrophils, are low in numbers. Common symptoms of infection include a temperature above 37.5 degrees centigrade, shivering, uncontrolled shaking, sore throat, flu-like symptoms, and generally feeling unwell. You will hear your nurses talk about neutropenic sepsis. This is an infection on top of a low white cell count, and it can be very serious. Every patient is given a 24-hour helpline number. Do ring this number as early as possible if you feel unwell. HEAT stands for history. Have you recently had chemotherapy? Examine. Do you have the symptoms we told you about? Action. Phone your 24-hour helpline without delay. Treat. Your helpline will advise you on what treatment is required. You may need to attend the hospital. Your hospital stay will usually be longer the longer you delay contacting us. Don't delay reporting side effects, as we need to act quickly on any problems and prevent admissions into hospital. Do keep this card on you. You can take it to your hospital to help them to understand why you need urgent treatment. Here are some of the things our patients have told us as to why they haven't reported their problems.
There are things you're warned about anyway, so you think, well, there's no point saying anything because they know this is going to happen.
You think, what can they do about it? They're just general things they must have heard a million times before, so I tend not to say anything.
I tend to say, oh, I'm fine, I'm really well. Because I think I've got off really lightly with the symptoms I have had, and I feel there are other people much worse off than me. So I feel guilty then, going on about it.
Well, the ward's so busy, they're worked off their feet. They're always really charming, but you think you can't keep burdening them, can you?